Good afternoon, everybody. It's Tess Crawley here, clinical and forensic psychologist and director of Dr. Tess Crawley and Associates Psychology Practice. If you've not met me before, we are based in Hobart with an office in Launceston, and we also do rural outreach to a number of areas within Tasmania, as well as providing online psychological services to those in need, no matter where you might be. Today I am talking about an issue that has popped up a couple of times in recent questions that I've been fielding. So I'm going to share today's post into a number of professional groups as well as our Stigma Rebellion group. So this is going to take me a couple of seconds. So I want you to bear with me because this is a topic that affects not just psychologists. This is something for you to consider in your own working life as well. So what we're going to be talking about today is to do with self-care and avoiding burnout in whatever role you might find yourself in. So I am going to talk about this from the perspective of psychologists, but I'll also try to weave into this ways that you can apply these concepts within your work, whatever your work might be. So if you're not a psychologist and you're interested in the topic of burnout and you want to know how we might apply these concepts to your particular field of work, please throw in some questions. I might have to run and get my laptop because I left it in the other room. So bear with me for 2 seconds while I'm posting into these other groups, because I think this is a topic that if we can get a number of people live today, we might actually find that we've got a good conversation happening. So bear with me while I do this. So if you've ever have you ever had that experience where you are dreading going to work? Tell me you've never had that experience and I won't believe you. If you've ever had that experience where you've woken up in the morning and you are just struggling to drag yourself out of bed and to get yourself started for the day, and then you get your shower, you get your teeth cleaned, you get some breakfast, you chuff off to work, and things start to roll on a little bit better for the rest of the day. Burnout is where that feeling kind of never leaves you. So burnout is where you are, still posting, sorry, where you can't get rid of that sense of dread, where you're not finding any joy in the work that you're doing, you're not finding any sense of purpose and drive in the work that you're doing, where you've become quite cynical. Now you can imagine that for professionals in a mental health setting, you can imagine how difficult it would be to provide a meaningful mental health treatment program if you're feeling cynical about your role. So what might that look like? Well, so being cynical in a mental health role, you might start to question the value of the therapy that you're providing. So you might not engage in that therapeutic process as meaningfully as you otherwise would. You might find it hard to like your clients. You might find it hard to believe some of the things your clients tell you. You might find it hard to be on your client's side. So when those things do start to pop up for you, that's a real challenge to your capacity to meet the demands of your role, isn't it? So you think about it from another health profession. So if you think about your GP, if your GP was burnt out and feeling cynical and not really coping with the demands of their role anymore and really feeling like they are a bit over it, they're not really invested in what's going on, you can imagine how that would have serious health consequences for some people if that particular GP was still functioning in their GP role whilst fully burnt out. So this is why I've actually put a little hashtag in there, ethical obligation. AHPRA, which is our registration authority for the registration authority for most health professions, and an increasing number of allied health professions are becoming or in line to become overseen by AHPRA as well. But AHPRA has very clear an area of concern, if you like, about health professionals and mental health professionals practicing when they're no longer mentally or physically capable of providing that service. So if you are, this is not to say that somebody with an anxiety disorder shouldn't be practicing. That's not what that means at all. It really is talking about whether or not this health professional, whatever field they're in, is capable of providing that health service in an effective fashion, because they're engaged, they're switched on, they're on top of the available literature, they're on top of the latest learnings in their field, or at least they've got some really good supervision that's keeping them informed and keeping them sharp and keeping them on target with the work that they're doing. Okay, I think, and I really hope, I've got all the groups now that I was hoping to share into. As I said before, this is a topic that affects not only mental health professionals, but it affects people in all walks of life. So think of a school teacher who's burnt out. Think of a nurse who's burnt out. Or think of somebody who's in a caring role, childcare workers who are burnt out. We can think of people in all professions where the issue of burnout is really quite significant when we stop and think about it. Would you like your 3-month-old baby to be cared for by a carer who's burnt out and doesn't really want to be there anymore, who's a bit over it? So when we think about that, we don't want anybody to reach that stage in their working life. We would like everybody in whatever role they're in to be feeling invigorated by the work that they're doing, or at least feeling challenged and interested and engaged in the work that they're doing, so that each day they come to work. It might still be hard to drag yourself out of bed on a Monday morning. We all get that. But once you get to work, you hit the ground running, you're interested in what you're doing, and you're providing the best level of care or treatment or teaching or whatever it might be to those people who are coming to you for that particular service. So how do we avoid burnout? And we can avoid burnout. We need to have some skills up our sleeve, and we need to have some insight into our own functioning. We need to be really honest with ourselves sometimes, and we need support sometimes as well. So those 3 things. So I'll start with insight. If you're somebody who overrides your own instincts, if you're somebody who doesn't listen to yourself very much or doesn't trust your own feelings very much, you might be overlooking the early signs of burnout. So those early signs that I mentioned before of just feeling like you can't get past that dread of going to work, feeling like you just can't muster the energy to be interested in your day. Now, everyone has a bad day like that, but when that starts to last for more than a day, when that starts to last for a couple of weeks, I'd be really sitting myself down and saying, okay, Tess, what's going on here? Why has this been going on? Now, it could be that you're depressed and that requires some treatment and then you're back on track. It could be that you're having some relationship difficulties and they need to be addressed, and then you can get back on track. Or it could be that you're burnt out in your job. So you really need to sit back and have a think, what's going on for me that has led to me having this experience? And then we get to that point of support. What's going on with the support that you're receiving? Now, talking about mental health professionals, I'll talk about psychologists in particular here, just as a good example, I think, but I'd like you to all, in your own field of work, I'd like you to have a think about what this means in your workplace. So, do you have somebody you can talk to at work? Do you have somebody who shows leadership and guidance in your workplace? Do you know who to ask questions of? So when you don't know what to do you feel safe in saying, I don't know what to do with this, again using the psychologist example, with this particular client, I feel like this is a bit outside my area of expertise, I don't know what I should be doing next, is there something I've overlooked? Now, if you're a provisional psychologist, so someone who's still training, or somebody who's working towards their registration, if you're working in a setting where you don't have any other psychologists on your team, that can be a really big challenge on a day-to-day basis of getting the support that you need. Is there somebody, even if they're not on site, who do you pick up the phone to and ring and say, I don't know what to do? Okay. Now, if there is nobody, firstly, who's providing your supervision, and why is that not happening more effectively? Secondly, if you don't have any other members of your team who are in the same profession, that can leave you feeling a little bit isolated too. So an example of that might be you might be the only psychologist in a team of allied health professionals working in a prison setting. So, okay, you've got other allied health professionals working with you who get what you're going through because they're going through it too. But if they don't understand what the ethical obligations around psychology are, or what the training obligations and professional development obligations are, how are they going to know what's causing you stress if those needs aren't being met? So sometimes professional isolation within your role, within your job, can cause a significant amount of stress and can leave you vulnerable not only to the stresses of the job that you're doing, but also that sense of isolation, that not knowing who to turn to for support, not knowing where you can get backup from, and feeling like nobody's got your back, feeling like it's all you're carrying the can. That's a really fast road to burnout. That lack of support and lack of leadership and direction around you. I mentioned also having some skills. So this is where we get onto the topic of self-care. And self-care does tend to be a bit of a buzzword sometimes. There's lots of memes around at the moment. Self-care is not selfish, which is true. Self-care isn't selfishness. It is about looking after yourself so that you can complete the tasks associated with your job, or looking after yourself so that you can fulfill your duties as a carer for somebody in your family, or looking after yourself so that you can parent effectively or teach appropriately, and so on. So self-care is a really important and valuable consideration and does require some skill. So self-care, as I said before, you do need that level of insight to notice that something's not going so well for you. You need to understand yourself well enough that you can see when it's starting to build up, that you're getting stressed, that you're getting worried, that you're getting anxious, that you're getting that sense of dread about going to work. And then you need to know what to do to get yourself back on track. So for some people, exercise is a great self-care tool. Other people, that leaves them feeling stone cold, like, don't make me go to the gym, please. So it might be talking to a friend. It might be making sure that you have time for mindfulness, meditation, yoga, whatever it is that calms you down physiologically and emotionally. For psychologists, you also need to make sure that you're making time in your diary for your professional development activities, for your supervision. And I don't really care how far advanced you are in your career. In fact, in some ways, the more advanced you are, the more you need an ongoing supervision plan, because the leadership burden can become quite great. So early career psychologists have to have a degree of supervision to meet their obligations, to get to their level of endorsements, or to get to registration to start with. But once you pass those hurdles of what you have to do, it's really important not to drop the ball and make sure that you identify the areas where you're feeling unsupported and get some supervision around that. Hi Mel, hi Kim, glad you're both here this afternoon. Supervision carries with it some connotations. The word supervision. People tend to think, oh, well, if I need supervision, it's because I've done the wrong thing or because I'm not skilled enough. I tend to think of the word supervision as mentoring. And one of my passionate areas in psychology is mentoring other psychologists from a clinical and growth perspective. So making sure that the psychologists in my team either have supervision with me or with another team member so that they're feeling supported. I think it's important that as a psychologist myself at this sort of level of leadership that I have some mentoring as well, which of course I've made sure I have this year in particular. But I think no matter what stage of your career you're at, supervision not only benefits you for your professional development obligations, but it also is a form of self-care. It keeps you talking, it gives you opportunities to debrief. Now, stepping away from psychologists again, that opportunity to talk about the stressful elements of your role, whatever it might be, that opportunity to debrief after a difficult day, and that opportunity to talk about things that seem to be popping up regularly as sources of stress for you. If you're isolated and not able to talk through those issues, then of course you're at risk of burnout because you're stuck with all that angst and stress and anxiety and worry, unpleasant feelings, that big knotted ball in the pit of your stomach. You need to know how to manage those. You really do. Now I'm just going to quickly check and see whether we've got any questions. I see we've got people who have said hello, but no questions at the moment, which is good. Oops, I don't want to press play because then I'll be hearing myself talking and that'll throw me. Okay, so if you have any questions, feel free to pipe up because I'm going to be wrapping up shortly. But also don't be afraid to pop some questions in later in the comments section below, and I will check them and I will come back to you. So if you're not watching this live, if you're watching it down the track, then do feel free to ask some questions. I'm happy to answer those for you. I'll throw into the mix a topic that I have mentioned before, which is the notion of online support. So, for example, recently I set up the Psychology Supervisors Australia closed group for psychology supervisors to help us, mentor each other and build a support network that way. And if you're a supervisor of psychology, please feel free to join. And I also set up the Rural Mental Health Professionals Australia Facebook page for the same reasons, to provide networking and support for rural mental health service providers around Australia, both health and mental health, with an interest in mental health and interest in rural health. No matter where you're located, if you have an interest in rural mental health, then please, as a health professional or mental health professional, feel free to join that group as well. Stigma Rebellion is another one. Stigma Rebellion is a closed version of my Facebook page so that people can touch base, ask questions, make comments without their whole Facebook community seeing what's going on. But beyond the groups that I've started, there are lots of others. Now, some of the groups I've posted into today have been established to support provisional psychologists or other professionals in private practice. Hi, Judy. Nice to see you here today too. There are lots and lots of groups online. If you are a remote area nurse and you want to support professionally, there's bound to be a Facebook group that you can join. If you're a teacher who's had experience of postnatal depression, there's bound to be a group out there of some sort that you could join and get some support that way. These groups and these forums typically, hello Amanda, welcome. Typically these online support groups will actually provide a little bit of a network, a little bit of a buffering, so that you've got someone. If there's nobody else that you can talk to, then at least there's the members of those groups that you can ask questions of or bounce ideas around with. So for example, the mentoring that I've been having this year has led me to join a number of groups for psychologists this year, and it's been amazing to be a part of, for example, a network nationally of psychology practice owners, whereas 12 months ago I felt relatively isolated in that role. Now I feel like I'm part of a very broad network of psychology practice owners around Australia, and we ask each other questions all the time, run ideas past each other all the time, and that's a fabulous forum for support. So have a think about what it is that might leave you at risk of burnout, whether it's your personal life or whether it's your circumstances at work. Have a think about what needs to change to reduce that risk for burnout, whether that's your own self-care, whether that's incorporating some form of supervision or professional mentoring, whether it's psychological assistance, whether it's treatment or counselling from a mental health professional to help you get through the hurdles. Have a think about what you can do from a range of skills, such as using some mindfulness apps, using some meditation apps, Smiling Mind, Calm, the Reach Out series of apps. There's a whole raft of resources on websites like Beyond Blue that you might find helpful. Even if you're not depressed, you might find some of those resources really helpful for you as well, just to get you through the day. And then at the end of the day, one of the most important factors in avoiding burnout is, drumroll please, knowing that you can leave your job if you're not happy. One of the biggest indicators of occupational stress is a sense of being trapped in one's workplace. So if you are working in a role and you're thoroughly over it, thoroughly sick of it, it's okay to say, you know what, maybe I could be looking elsewhere. Maybe I could retrain. Maybe I could cut my hours back and spend maybe one day a week doing something I'm passionate about to bring that balance around. And I know people are trapped in their financial circumstances as well. So maybe seeking some financial counselling around how your circumstances could be changed for the better for you. Get advice. There's plenty of it out there. You just need to ask. That's it for today. That sort of was quite an inspired topic, prompted by a couple of questions that I had this morning within the Stigma Rebellion. You see, it's a great little community, this Stigma Rebellion. Questions get asked and it triggers ideas in my mind, and then I can pass those ideas on to the rest of you. So if you're not a member of the Stigma Rebellion, you can find that on Facebook. Feel free to join. Also, feel free to like and share this page if it's of interest to you and your friends or your co-workers, and I'd welcome you aboard as a member of our team. Take care for today. Have a lovely Monday evening, and I'll talk to you all again tomorrow. Thanks for that. Bye-bye.